Hello and welcome. My name is Erica and I am a public health nurse that is here today to talk about the important issue of adolescent and teen suicide and what we can do to help. So let's talk about this issue. Adolescents, specifically girls, aged 10 to 18 years old, are impacted most. However, girls aged 10 to 14 have experienced the largest increase in suicide in recent years. This issue affects all areas of the country. Factors that may be negatively influencing higher suicide rates in recent years include girls hitting puberty earlier, antidepressants coming out with a black box warning which caused doctors pause before prescribing young people these drugs, and the economy making it harder for young people to access health care and treatment, as well as a lack of health insurance. So girls who experience getting their period at an earlier age show higher levels of depression than either boys or their female peers who mature later than them and are more likely to attempt suicide. This onset of puberty can bring about feelings of confusion, fear, and anger, all which can lead to depression. In 2004, the FDA required a warning to be included, known as a black box warning, in the label of antidepressants regarding an increased risk suicidal thoughts and behaviors in adolescents and children taking these medications. Although the FDA meant well through this action, this actually may have caused a decrease in prescriptions for these drugs as doctors were heeding this warning. This also means adolescents were going untreated for depression, which can lead to suicide. The economic decline that started in 2008 left many workers without a job, or those with a job more stressed due to increased workloads and pay being reduced, which increased stress levels and increased negative mental health. For those that lost their jobs, this included health benefits and health insurance. So for parents with struggling children, this meant a lack of access to health services and treatment that would benefit them. I've gone ahead and created a table that applies the social ecological model to this issue and describes a factor promoting health and one hindering health at each level. So for an individual, having good coping skills and knowing resources that are available if they are needed, as well as having a healthy and positive attitude promotes health, while a dependence on substance abuse such as drugs or alcohol can intensify feelings of depression or sadness in teenagers, which increases the chance for suicide. At the interpersonal level, supportive relationships with peers and involvement with school can boost one's self-esteem and therefore lower the risk of suicide. However, having a family history of mental illness and/or suicide can increase a teenager's risk of suicide. For the organizational level, support in schools via a guidance counselor or health educator who educates students on mental health programs and resources available for help can promote health, while a lack of access to health insurance and medical care or treatment can increase the risk of adolescent suicide since they would not be able to get help if needed. At the community level, conducting a public awareness and educational campaign can lower the risk for suicide. Hotlines and crisis response outlets provide teenagers a safe place to talk to someone. While the media and social media can have a negative impact on teens and be a negative risk factor for suicide. Enacting a national mandatory mental health curriculum in schools that included topics such as suicide would help to provide education and knowledge of support and resources available to young students in order to prevent suicide, and this would help promote health at the policy level. And as I touched on before, in 2004, the FDA required a black box warning on the label of antidepressants regarding an increased risk of suicidal thoughts and behaviors in adolescents and children taking the medication, and this hinders health. Today I will be discussing 3 proposed interventions that I believe would be beneficial in helping to address this issue at hand. A suicide prevention hotline for adolescents would be extremely beneficial for those teens that feel that they are completely alone and isolated and want to reach out to someone neutral to talk to rather than their parents or friends who they feel may not understand. A real example of this is the National Suicide Prevention Lifeline, and their mission is to provide immediate assistance to individuals in suicidal crisis by connecting them to the nearest available suicide prevention and mental health service provider through a toll-free telephone number. And going back to when we were discussing this issue at the beginning of the presentation, this ties back to the lack of access to resources, as this is a free service that is available to all. The goal of this intervention is to prevent as many adolescent suicides as possible and to provide teens in need with a safe space to listen and refer them to local resources. So how will we achieve this? The resources needed include mental health professionals who will comprise the staff, funding, trainers to train the staff, and promotional materials such as advertising. A form will also be created for the hotline staff to use while speaking with callers, and information collected will include age, gender, location, the reason for calling, such as they need information or they need someone to listen, the referral source, did they find this hotline from a TV ad or a magazine, etc., and also the time of the call to determine if teens are more likely to seek help in the evening or in the morning. It will also include information if the staff member referred the caller to a resource, such as a local crisis center, clinic, mental health professional, or website. This information will be compiled on a monthly basis to be reviewed annually against baseline data, which includes statistics on teen suicide collected from national databases and the previous year's data. This data collected will be used to identify trends, and success would be considered increased number of calls to the hotline, reduced annual number of teen suicides, and suicide attempts in the community. There will be challenges to success. It will be important for the hotline staff to not only ensure they are completing the form for every caller, but that they are also accurately completing the form and collecting all information needed. It will also be important to keep the forms and information gathered organized and compiled on a timely schedule, such as monthly, to be reviewed yearly, and to ensure all data is able to be included in the reviews. A solution to these challenges would be to ensure that the training is adequate, including role-playing and also having ongoing training. The second proposed intervention is for a suicide screening program. A screening program tailored for adolescents to identify warning signs of depression or other factors that can lead to suicide can be implemented in various settings, such as a school. An example of a successful screening program is the Teen Screen program, which is a community-based mental health screening program for young people that accurately identifies youth who are suffering from mental illness or at risk of suicide. The program's primary objective is to help young people and their parents through the early identification of mental health problems, such as depression. Parents of youth found to be at possible risk are notified and helped with identifying and connecting to local mental health services where they can obtain further evaluation. The school gatekeeper model is one prevention method that has shown to be effective in screening programs. Training school personnel, considered the gatekeepers, to improve their knowledge, attitudes, and skills to appropriately intervene with students at risk of suicide, providing crisis intervention to engage suicidal students' support networks, and facilitating suicidal students' referrals for treatment and counseling. Using this model increases the proportion of students who access specialty mental health services. The goal of this intervention is to accurately identify teenagers who are suffering from mental illness like depression or at risk of suicide and help them and their parents to get help successfully. The resources to be able to do this would include mental health professionals and school personnel. Example of gatekeepers at the school would be teachers, school nurse, and the school counselor. We'd also need to partner with an organization that can provide training and trainers that can come on site. We can achieve this by, for the screening program, all high schools in this community will administer the Youth Risk Behavior Survey, otherwise known as the YRBS, to students in grades 9 through 12 at the beginning of the year, so that students would take it multiple times. The results to the mental health questions can be used to gauge the level of risk and the approximate number of students who may be at risk for depression or other risk factors for suicide. It also can be used to measure baseline awareness of mental health services available and risk factors. Demographic information would also be obtained at the community level to help determine a baseline for the number of completed adolescent suicides in previous years. Staff trained in mental health will compile the results and analyze areas that need to be improved. Results would be compared to previous years to determine if the risk has gone up or down. Guidance counselors and school nurses can also use these survey results when meeting with students who they feel may have mental health issues like depression or may be at risk for suicide. Success of the program would be decreased perceived risk of suicide and increased positive attitudes per the annual YRBS survey taken by the students. Also, a reduced number of annual adolescent suicides in the community. To ensure successful evaluation, it is important to ensure all students complete the assessment each year, so a tracking system must be put into place to measure completion by all students. It will also be important to train the administrative staff who will be compiling the answers from the YRBS on the best procedure to compile these in a way that is useful to those who will be reviewing the data, such as the school counselor or psychologist. The last proposed intervention I will be discussing today is curriculum-based education on mental health and suicide. Findings suggest that psychoeducational programs in schools may influence knowledge about suicide and attitudes towards suicidal persons, but may not affect the use of coping styles or levels of hopelessness. These programs have been shown to increase teens' positive attitudes towards seeking help after completing the program. Suicide awareness and prevention knowledge can be incorporated into the school's curriculum, so all students have to complete it. The goal of this intervention is to help reduce the stigma and educate young people on resources available to them if they need help, and also to increase their knowledge and awareness of the topics. We can achieve this by school health curriculums will include mental health education and suicide awareness. To test the effectiveness of the addition of these topics to the health curriculum, the mental health curriculum in high schools will be taught in half of the health classes offered and will not be taught in the other half of the health classes offered. Survey assessments will be taken by students in all health classes, regardless of whether they are receiving the new curriculum on mental health or not, at the end of the class to determine the level of success in gaining knowledge of resources and help available and how much this mental health education attributed to this. The survey will ask students to rate their knowledge on resources available to get help, warning signs, risk factors, etc. The results of the survey can be compared between the two groups to determine if it was successful and if it is warranted in all health classes. It will be important to ensure that the health educator who is teaching the curriculum is adequately trained and qualified to teach these topics. Another important aspect to consider is that the survey assessment include questions that are relevant to evaluation and that the staff member compiling the answers is trained and organized. In the logic model that I have created, you can see that the ultimate goal with all three of these interventions is to reduce the number of teenage suicides and improve the mental health of teenagers. By increasing awareness of the resources available and the risk factors, this will help prevent potential suicides and reduce the stigma that may isolate teenagers and put them at risk in the first place. I want to thank you all for coming out today to participate in this discussion and hear about some proposed interventions and ideas that may help to address this issue.